Hey everyone, me Kevin here. Mark Meadows made news this morning by suggesting that we're not going to control this pandemic. What I'd like to do is play some of the content of Mark Meadows saying this on the interview with Jake Tapper Sunday morning here on October the 25th. And let's add a little bit of commentary to see how maybe we can look at this from both sides. So let's go ahead and pull this up. Let's see what we've got going on. Let's see what we think. Let's go ahead and play this.
So here's what we have to do. We're not going to control the pandemic. We are going to control the fact that we get vaccines, therapeutics, and other mitigation.
Why aren't we going to get control of the pandemic?
Because it is a contagious virus, just like the flu.
Yeah, but why not make efforts to contain it?
Well, we are making efforts to contain it.
By running all over the country, not wearing a mask?
Jake,
that's what the vice president's doing.
We can get into the back and forth.
Okay, let's pause on that for a second. So look, here's the thing. We know that the mortality rate for COVID is falling substantially. We know that the survival rate for most groups is around 99%. I think the death rate for all groups and all ages is somewhere around 1.5% if we average it all together. Obviously, if you have a comorbidity or an underlying health condition, you would be at higher risk. And in fact, in my opinion, if you are at higher risk, it would be a very good idea to watch the video that I made on masks that can give you essential immunity. See, I personally believe that the cloth masks don't really help you much, and I think a lot of us can agree on that. But there are some of us, for example, my wife, who has an underlying health condition, and when she goes out to a store, she wears a proper P100 respirator and a mask over that, and you can watch my video explaining the different respirators and showing you where you can get them if you want and things like that. But yeah, the reality is the mortality rate of this is very low. On the other hand, though, it's very dangerous for people with those comorbidities, and there's probably this extra ramp up certain individuals should do to protect themselves. But I will say, and then that's sort of my idea there aside, right? I do have to say, I think as a country, for the White House Chief of Staff to say that we're not going to control this pandemic is very bad. Very bad politically, right? Because politically, this now gives Democrats an easy way to assail the White House as saying the White House has given up. They're not even attempting to control this pandemic. They're waiting for therapeutics and for a vaccine to bail us out. Not a good political look, big political faux pas there. And it also takes away, in my opinion, some of the urgency for all of us as a society to work together to do what we can to minimize our risk. That is, it would be nice if our government and our leaders had a consistent message. We know that we went from we shouldn't buy masks to we should buy masks because they were worried there wouldn't be enough available for healthcare professionals, but we are still in the midst of a pandemic, so I do still believe that probably outdoor gatherings should be preferred over indoor gatherings. Washing our hands and being socially distanced, probably really good ideas. Unfortunately, I think this statement right here is going to be damaging to Donald Trump's re-election campaign, and I'm not taking political sides on any of this, just trying to provide the perspective and bring this insight in. Let's go ahead and keep seeing what Mark Meadows has to say here, and we'll keep adding commentary.
Let me just say this, is what we need to do is make sure that we have the proper mitigation factors, whether it's therapies or vaccines or treatments, to make sure that people don't die from this. But to suggest that we're going to actually quarantine all of America, lock down our economy.
No one's saying that.
Well, they are. Joe Biden's saying that. He says lock everybody down.
Now, in fairness, Joe Biden has not ruled out lockdowns, but he has not suggested that we will do lockdowns. Joe Biden has said that we will have a universal mask mandate, which again, this is a mandate on the cloth masks, which is nice because the cloth masks do prevent your sort of breath and your aerosols from spreading more than about 2 to 3 feet. That's why they have the combination of the 6-foot distancing rule. So that helps for that POV. But if you walk into a restaurant or a small store like a UPS store or something, and somebody's been working in there with COVID all day long, you're walking into a COVID cloud. Don't kid yourself, the cloth mask isn't gonna help you. You need a respirator, otherwise you're getting exposed. Okay, let's keep going. Oh, but yeah, on the vaccines and therapeutics here, of course we want vaccines and therapeutics, but I think the reality is many of us don't want to wait in this fear state until the middle of next year, because we don't actually expect everybody to have vaccines widely available if we even choose to take it until the second quarter or third quarter of 2021. The reality is, I'm in California, which is much more locked down than the rest of the country, and we still can't send our children to school. We're still homeschooling. We're tired of this. We want to go back to normal. Then pandemic fatigue sets in, and we stop caring about the pandemic, and well, what happens? Now we've got more cases surging again. It's not good, and I think this is improper messaging here. And I'm not advocating for a lockdown. But I do want to add clarity too. I don't know that Joe Biden is 100% saying, oh, that's it, I'm going lockdown. I know they are branding him as Lockdown Joe. But in fairness, he has not yet clearly said he will go for lockdowns. And I'm going to make comments here on both sides where there are things that are accurate or inaccurate.
We're going to have a dark winter. We're going to have a dark winter.
That's what health officials say. That's what health officials say, that it's going to get worse.
No,
we
that's
have the two
Joe Biden's
worst days.
Jake,
let's be honest. Infections, Friday and Saturday.
Let's be honest here. The health officials did not say dark winter. Those were Joe Biden's words.
He was quoting a health official.
And now, in fairness here, it was Joe Biden who did say that we're heading into a dark winter and that Donald Trump does not have a plan. That was said during the final debate. Now, maybe health officials told Biden that, but it's definitely Biden who popularized the phrase dark winter. Which I think why that matters is because obviously a politician saying we're going into a dark winter is very different from, let's say, the CDC coming out and saying that. And I will say I did just do a quick Google here for dark winter in quotes, and I can't find any specific quote other than Biden's. And it's possible, again, because Biden popularized this, that it's swamped all the search results. But I have personally not seen health officials say dark winter other than the respect of quoting Biden. And again, trying to just be fair to both sides here. It's very tough to do in this day and age. Okay, I'm trying my best.
Quoting William Haseltine.
When we look,
wait.
A health official. I think he was quoting William Haseltine.
Okay, quick follow-up. I just Googled William Haseltine and dark winter. Can't find anything. All right, let's keep going.
When we look at the number of cases increasing, what we have to do is make sure that we fight it with therapeutics and vaccines, take proper mitigation factors in terms of social distancing and masks when we can. And when we look at this, we're going to defeat it, Jake, because we're Americans. We do that, and this president is leading while Joe Biden is sitting there suggesting that we're going to mandate masks.
The president is holding rallies all over the country.
That's correct.
No
In fact,
masks,
we're leaving.
No masks required, no distancing. There have already been, according to health officials, contact tracing. There have already been cases of individuals in Minnesota and in Washington, D.C., and in Oklahoma that got the virus at these Trump rallies that Dr. Fauci himself called a super spreader event, the one at the White House.
There's also been contact tracing, Jake.
That is not leading.
There's also been contact.
I want to add a note here. So look, there has been one report that at the Trump Minnesota rally, cases may have been linked to Donald Trump's rally. In fact, here it is. This is ABC News. 9 COVID-19 cases linked to Minnesota Trump rally last month, 2 hospitalized. So something to keep in mind is obviously outside is significantly safer because we have air that flows more freely. We don't get that COVID cloud that builds up. The issue with that is even if you are outside, if somebody is coughing or sneezing within your vicinity, yeah, you could get a pretty fat dosage of COVID. And yeah, that could lead you into the hospital, which remember, dosage is really important. This is why people are asymptomatic or not asymptomatic in most cases. Some say it's blood group, but a lot of researchers say that the reason some are asymptomatic is because they had a very low dose. You walked into the UPS store, you got exposed to COVID, you drop the box off, you leave because you didn't have a mask on or whatever, or even if you had a mask on, maybe you still got it anyway because you didn't have a respirator on because most people don't have respirators. And boom, you catch a little bit of COVID, boom, you're asymptomatic, and you give it to somebody else, maybe a family member whom you're living with, you give them a full dose, boom, they're in the hospital. It's tough situation. This is a very, very, very tough virus because of that. And again, look, I'm not discounting the fact that we've got a very high survival rate for this, but the reality is, me personally, as an example, I don't want to get sick because I don't want 2 weeks off work. And the flu sucks too. All right, let's keep going here. Let's see what else we got.
tracing from reporters, some with your own group, where they actually have worn masks religiously. And so what I'm here to tell you is we need to find the vaccines and the therapeutics to actually give Americans the relief that this is not a death sentence, because it's not. And yet at the same time, to suggest that any of that is not accurate is just not based on the facts.
Here's the bottom line. We know, according to health officials, that masks are the best thing people can do in terms of trying to prevent the virus from spreading, period.
Yeah.
That's what they say. Until the vaccine and Operation Warp Speed, and until that all works out, the best thing to do are masks. That's from Dr. Redfield, it's from Dr. Fauci, it's from Dr. Burks, it's from everybody. Okay? Vice President Pence is the head of the coronavirus task force. He has been exposed to somebody who tested positive. The CDC guidelines say he should quarantine. Now you're trying to say his running all over the country, meeting voters, campaigning is an essential worker business. I don't think it is, but okay, if you do that, why is he not wearing a mask? I haven't seen any pictures of him on the tarmac or anywhere wearing a mask. And
Okay, so let's talk about that. I get the whole essential worker argument because obviously the election is 9 days away. Now, with knowing that the election is 9 days away, it makes sense that Pence is going to continue to campaign here. Although, in fairness, Kamala Harris, when her staff was exposed, she quarantined. She went off the campaign trail. Mike Pence, though, if he has potentially been exposed, it's probably even more of a reason that he should wear a mask.
Should the American people follow the CDC guidelines, or should they not? Because the vice president is not.
Well, I can tell you he is wearing a mask. He will be wearing a mask today as we have this. Obviously, when you have an exposure, you have to take additional mitigation factors to do that. But the other part of that, Jake, is this, is even those experts that you talked about, when we talk about masks, I said, well, if mask is the answer and mandating mask is the answer, can we put all our students back in schools? If we just mandate mask and make sure the teachers wear masks,
should Americans follow CDC guidelines?
Will they be safe? And the answer was no.
Interestingly, the state of New York actually found that in their 18,000 schools, they had extremely few COVID transmissions. For some reason, schools, even though we thought they might be a virus hotbed, they are not becoming a COVID hotbed. This is actually very similar to what was found in Europe when they opened their schools. Yet despite this, schools in California are still shut down with the exception of certain private schools, which have received exemptions. Then Mark Meadows goes into them passing out masks and all that, but we kind of got an idea here of what's going on. This gives you some more context in case you see the headlines of Mark Meadows saying, hey, you know, we're not going to control this pandemic. You know at least where this came from. I think this is useful context. If you like this sort of reaction video, let me know. It's tough because this is politically touchy. So usually on these videos, I get more dislikes. If you liked it, though, I'd really encourage you to, especially on videos like this, like it, consider sharing it. Make sure to get your 3 free stocks with Webull via the link down below. That offer does expire at the end of the month. You can, of course, get the bundle coupon code as well by emailing me for the courses down below. Get your life insurance, and folks, we'll see you next time.